In this video, we will be seeing about the two main non-communicable diseases. One is the road traffic accident, and second is the blindness. So, first, what is accidents? Accidents are unexpected, unplanned occurrence which may involve injury and unpremeditated event resulting in unrecognizable damage. So the cause of accidents includes first is the road traffic accident. One is the unintentional, which includes RTAs, poisoning, falls, fires, drowning, and other injuries. While some things can be intentional accidents, which can be self-inflicted, violence, war, homicide, and others. So RTA causes almost 1.25 million road traffic deaths around the world every year, and 3 out of 4 road deaths occurs among men. So, the global burden of RTA includes 49% of all road traffic deaths are among pedestrians, cyclists, and motorcyclists. So, if we take only in India, the burden of road traffic deaths includes around 7% of four-wheeler drivers, 10% of passengers in a four-wheeler drivers, then 7% of drivers or passengers in buses, and 9% pedestrians die due to road traffic accidents every year. So the factors includes for road traffic accidents is first is the age. Mostly young people and children are more prone to RTAs, and male gender are more prone to RTAs. And lower rate of literacy, middle and low income countries, and people who are having occupation as drivers, and lack of body protection includes helmets and safety belts are the main cause for the road traffic accidents. So one of the etiological factors include high speed and drinking alcohol, and driving increases the risk of the road traffic crash. In BAC, that is in blood alcoholic concentration of 0.05 has a risk of road traffic crashes which increases dramatically. And other etiological factors includes lack of protection such as helmets or safety belts, and distracted driving. Then other precipitating factors include vulnerable road users, use of stolen vehicles, psychosocial factors, and emotional tension. And environmental factors includes relating to road, that is a defective narrow road, defective crossroad, and speed breakers, bad weathers. So these are all the environmental factors which leads to road traffic accidents. So thus we have seen the agent, host, and the environmental factors. So head-on matrix of road traffic accidents explains about the various factors and phases and how it is related to the road traffic accidents. So first is the human, and there is a pre-crash and crash prevention, again for vehicles and equipment and environment. So if we take humans, the humans' information, attitude, and impairment and police enforcement is mainly needed in the pre-crash or for crash prevention. And crash mainly occurs due to the restraint impairments. And post crash, we have to give the first aid skill access to the medics. Similarly, factors, that is vehicles and equipments, roadworthiness, occupant restraints, and ease of access. While environment, road design and road layout, and crash protective roadside objectives. So this is the head-on matrix. Then second is the safety education. Mainly focus group has to be done on school children and training the drivers in proper maintenance of vehicles and safe driving. So promotion of safety measures, mainly wearing a seatbelt reduces the risk of fatal injury up to 50% for front seat occupants and 75% for the rear seat occupants. And child restraints and enforcement of strict laws is compulsory wearing of helmets and seatbelt, driving test, medical fitness to drive, enforcement of speed limits, and regular inspection of vehicles. And strictly enforcing a drink driving law can reduce the number of road deaths by 20%. Then the various preventive measures include, first we need to have the basic data on the RTA. So for first we need a basic reporting system, special survey and in-depth interviews, investigate to identify legal and preventive measures, and rehabilitation services and accident research, And to conclude, accidents don't just happen, they are caused. And the cause in the given situation must be identified by the epidemiological methods. And since accidents are multifactorial, they call for an intersectoral approach for both prevention and care of the injured. So, moving on to our next topic, that is blindness. So, what is blindness? WHO defined blindness as a visual acuity of less than 3 by 60 as per Snellen's or its equivalent. So, the burden of blindness includes around 285 million people around the globe, and about 90% of the world's visually impaired live in a low income settings, and 82% of the people living with blindness are age 50 and above. So in India, the definition for blindness is a person who is unable to count fingers from a distance of 3 meters would be considered as blind. So the prevalence of blindness, according to Rapid International Survey on Blindness 2006 to 2007, was 1%. So the various causes of blindness include, the main cause is the cataract, which around contributes around 62% of the blindness in India. Then second comes refractive error, glaucoma, posterior segment pathology, corneal opacity, surgical complications, posterior capsular obfuscation, and other causes. So the epidemiological determinants, coming back to our epidemiological triad, that is age and host and environment. Host in age of mostly in children and young people are more prone to refractive errors, trachoma, conjunctivitis, and adults are more prone for cataract, refractive error, and glaucoma. So higher prevalence of trachoma, conjunctivitis, and cataracts is seen in women, leading to higher prevalence of blindness in women. And malnutrition, mainly the protein energy malnutrition and severe blinding corneal restriction due to vitamin A deficiency in the first 4 to 6 years of life. Social class includes survey indicates that blindness twice more prevalent in poorer classes than in the well-to-do. And other social factors such as ignorance, poverty, low standards of personal and community hygiene, and inadequate healthcare services. So, prevention of blindness, the components for action in national program for the prevention of blindness comprise the following. First is the initial assessment, and method of intervention can be primary eye care, secondary eye care, and tertiary eye care. So, in primary care, wide range of eye conditions can be treated or prevented at grassroots level by locally trained health workers who are first to make contact with the community. They are also trying to refer the difficult cases to the nearest PHC or district hospital. Secondary care involves definitive management of common blinding conditions as cataract, trichiasis, entropy, and ocular trauma and glaucoma. It is provided in the PHCs and the district hospitals by eye departments or established. Tertiary care include established in the national or regional capitals and often associated with the medical colleges and institutes of medicines. It provides sophisticated eye care such as retinal detachment surgery, corneal grafting, which are not available in the secondary centers. Specific programs include trachoma control, school eye health services, vitamin A prophylaxis, and occupational eye health services. Long-term measures are aimed at improving the quality of life and modifying the factors responsible for eye problems. Poor sanitation, lack of adequate safe water supply, and poor nutrition, lack of personal hygiene are the main issues to be addressed. So, National Program for Control of Blindness and Visual Impairment and Vision 2020 Right to Sight and Global Eye Health Action Plan of 2014 to 2019 are the few national programs which mainly aims at the prevention of blindness. Thank you.